Hey there, my name is Andy Hollowell. I'm a licensed clinical therapist, and I hope you find this video helpful.
For people struggling with mental health challenges, awareness of triggers is vital and empowering. Triggers for individuals with borderline personality disorder or BPD vary and, without coping mechanisms, can lead to significant distress. Knowing your unique triggers enables you to cope and take proactive steps to avoid or lessen potential stressors. Awareness of triggers can also contribute to a reduction in impulsive behaviors and help you avoid potential mental health crises. Borderline personality disorder is a cluster B personality disorder. That means it causes erratic or dramatic behavior patterns. Borderline personality disorder, or BPD, is characterized by unexpected behaviors and emotional instability. Today, we'll talk about common borderline personality disorder triggers to be aware of and how you can cope with them. We'll also discuss how the precision care model can help you address your triggers for the future. So what is a borderline personality disorder trigger? In the context of mental health, triggers are stimuli or events that elicit a strong emotional or psychological reaction, often linked to past traumatic experiences or conditions. Triggers can activate intense emotional responses such as anxiety, fear, anger, or sadness, and may lead to re-experiencing symptoms related to a mental health condition. Triggers for individuals with borderline personality disorder can vary widely. A person can have episodes of dissociation, emotional outbursts, or dangerous behaviors. Triggers can vary from person to person as well, but there are several borderline personality disorder triggers that are common among diagnosed clients. Here are 3 borderline personality disorder triggers that you should be aware of. First, fear of abandonment. The fear of being abandoned or left alone can be a powerful trigger, influencing behaviors and emotions. Intense, pervasive fear of abandonment is a common experience among individuals with borderline personality disorder. This fear may be out of proportion to the situation and can lead to extreme emotional reactions. This fear may be exacerbated or triggered by perceived threats to relationships, even if those threats are not real or imminent. Next is traumatic memories. Not only do many individuals diagnosed with borderline personality disorder have a history of exposure to various forms of trauma, but trauma can actually contribute to the development of the disorder. When these individuals are faced with situations, stimuli like sounds or smells, or experiences that remind them of a trauma, the intense emotions and distress associated with that traumatic event may be reactivated. And third is perceived rejection or criticism. Individuals with borderline personality disorder often struggle with a distorted and unstable sense of self. Perceived rejection or criticism may be interpreted as confirmation of negative self-talk and exacerbated feelings of worthlessness. Sometimes even minor instances of perceived rejection or criticism may trigger significant emotional distress for individuals with borderline personality disorder. This is due in part to emotional dysregulation, another characteristic feature of borderline personality disorder. So, how to cope? When you experience a borderline personality disorder trigger, what do you do? Once your borderline personality disorder symptoms are triggered, it can feel like they'll never stop. But if you experience a trigger, there are ways that you can manage your symptoms in the moment or later, depending on the circumstances. Finding healthy coping mechanisms can help you as you navigate triggers throughout your mental health journey. When learning about different strategies and borderline personality disorder coping mechanisms, it's important to remember what works for one person may not work for another. Here are a few ways that you can handle a borderline personality disorder trigger to minimize your symptoms. First, distract yourself. By pulling your mind away from the trigger and toward another activity such as exercise or creative outlet, you can reduce the effect of the trigger and focus on the positive emotions that come from doing an enjoyable activity. Next is practicing mindfulness. Practicing mindfulness through meditation can help you be present in the moment. By grounding yourself in reality, you can reduce your borderline personality disorder symptoms such as impulsive behavior. Third is acknowledging your behaviors and emotions. By increasing your self-awareness, you can take note of your emotions and current behaviors so that you can see how you reacted to the trigger. By acknowledging your symptoms as they're occurring, you can gain control over them. While learning how to cope with borderline personality disorder triggers in the moment is helpful, it's important to seek treatment for your disorder to develop skills that will help you long term so that you can help manage episodes in the future. The precision care model is a holistic, Personalized treatment that allows a Lightfully clinical therapist to treat your entire person, not just your borderline personality disorder symptoms. The goal of the precision care model for borderline personality disorder is to help you reduce your symptoms and address the root of your disorder through evidence-based, integrated interventions tailored to your particular needs. The precision care model focuses on 4 core processes that are at the basis of borderline personality disorder: difficulty with emotions, difficulty with thoughts, difficulty with relationships, and difficulty with behaviors. While there are many integrated interventions that can help you progress on your mental health journey, arousal reduction will likely be included in your treatment to recognize and address borderline personality disorder triggers. While borderline personality disorder can't be cured, with treatment and support, you can learn to manage your symptoms, build resilience, and gain strategies to help you cope with your triggers. Lightfully's precision care model enables us to deliver personalized care for individuals struggling with borderline personality disorder and co-occurring mental health challenges. Treatment can help you learn how to handle your emotions, thoughts, and behaviors. The precision care model can help you develop needed skills and coping mechanisms. The framework of our clinic consists of evidence-based, clearly defined, data-driven, and whole person-centered care. Change is possible. When you're ready to take the first step, reach out to our admissions team. We'll take the next steps together towards the fullest, brightest version of you.